Medicare has many parts, A, B, C, D. This video is one of 4 about Medicare Part A. Welcome, I am Martine Bruce, your medical bill whisperer, committed to bringing answers, insights, and solutions to patients like you. Today, let's go over the very basics of Part A. What is this important benefit period? What services are covered and at what cost? What restrictions should you be aware of? And then, as always, I'll share tips to help you along. For those of you with a Medicare Advantage plan, be aware that although your policy must cover the same services as original Medicare, special rules may apply. So first, that benefit period. It is what defines how much your cost will be. Why? Because your cost changes according to how long you or your loved one remains inpatient in a facility. The day of admission to any facility, hospital, or skilled nursing facility, the clock starts running. This means Medicare starts making payments on your behalf. If you are discharged less than 2 months later, you must wait 60 days from that discharge date before a new benefit period starts again and benefits resume. Let's say you become inpatient on March 1st. Your benefit period starts March 1st. If you are discharged on March 15, that benefit period will end 60 days later on May 14. If you must remain inpatient for more than 60 days or 100 days in a skilled nursing facility, Medicare benefits at 100% will stop and further bills will be sent to you. The good news, there is no limit to how many benefit periods you can accumulate in your lifetime. But the less good news, each benefit period has its own deductible. Now let us go over the 5 major areas covered by Part A by order of importance. Inpatient hospital care. Part A covers what the hospital or facility bills for: use of a room, of a nursing staff, medications, supplies, use of the operating room and of all the equipment, and more. In 2023, the deductible is $1,600. Then you pay nothing until day 60, then $400 a day between day 61 and 90. After 90 days, your cost doubles and another countdown starts. Medicare gives you 60 reserve days, a bonus per lifetime. But once those days are used up, whether all at once or over several months or even years, you will owe 100% of the bill. The second largest use for Part A is skilled nursing facilities. Usually this is where you get transferred if you are not sick enough to stay in a hospital, but not well enough to go home. Part A covers the use of a bed, the nursing staff, medication, supplies, transportation to medical appointments if these cannot be rendered in-house. Different types of therapy are also included. You pay nothing for the first 20 days, then a copay of up to $200 a day. But should you have to stay longer than the 100-day limit, the total share of cost is yours. Now, paying for external professionals that may have to come to the nursing home or skilled nursing facility when the in-house staff cannot perform such duties is also covered under Part A. That would include infusions, some injections, wound care, and more. Hospice care must be certified by a doctor. If a patient is deemed to have less than 6 months to live because of a terminal illness. Whether rendered at home or in a nursing home, hospice services only provide palliative or comfort measures. Hospice cannot include any treatment, except in some rare occasions when a new condition develops. For example, a dying cancer patient breaks a bone but requires immediate intervention. There is no cost to patients for hospice care. Last are some home services. These only apply to patients who cannot leave their home to get medical care due to physical limitations or conditions. Services need to be temporary and usually cover nursing services, again, infusion, injections, wound care, certain types of therapy, speech, occupational, physical, and some medical supplies. There must be ongoing documented evidence of improvement of a medical condition or at least stability so that coverage can continue. The cost is zero. Although do note that some independent providers might have to bill Part B. As in everything in healthcare, there are limitations. For inpatient services, professionals must bill Part B. These are the different doctors working at the hospital, but not its employees. Their payment and therefore your share of cost will be based on a different format. Do watch my video on Part B for more information. And whereas there is no lifetime limit on the number of benefit periods, mental health inpatient care is limited to 190 days per lifetime. As for private nursing services or other items deemed personal or for comfort, these are not covered under Part A, even when rendered in a hospital setting. Private room, massage therapy, for example. For skilled nursing facility days to be covered, you must have been inpatient for at least 3 nights in a hospital. This does not mean you stayed there for 3 days, because you could have been under observation while your doctor decided whether you could be discharged or had to stay longer. Yes, it can take up to 3 days and it makes little sense. But observation days are payable under Part B as they are considered outpatient. So unless you have been declared inpatient for at least 3 nights, you may not qualify for skilled nursing facility care. Nursing home services must be medically necessary and not custodial. What services can be performed by the patient or a non-licensed person are not covered under Part A. This means someone helping with food prep, bathing, companionship, supervision, chores, or other basic non-skilled medical care, such as dispensing oral medications or applying a Band-Aid. And if the level of care drops, either because the patient no longer requires it or because benefits cannot be justified any longer, coverage and payments will stop. Hospice care, as we have seen, cannot cover attempts at reversing or treating a terminal condition. As for home health services, they must be justified on a regular basis and medical necessity confirmed by a physician. I have mentioned your share of cost throughout this video, but most Medicare patients have a secondary, also called Medicare or supplemental policy to cover part or all of their financial liabilities. Low-income seniors may qualify for Medicaid as that secondary plan. Do watch my special video and that on Part B for more details. And for some useful tips, coverage and payments only apply to Medicare providers or those who accept Medicare assignment. So do confirm the status of a provider before hiring their services or whenever possible. And if a provider thinks or knows a service or item may be denied or is not covered by Part A, they must give you an advanced beneficiary notice. This ABN form will list what item or service is in doubt and the estimated price. You will be asked to sign it before going ahead. Medicare.gov is a treasure of information, simple and clearly searchable. The tab, What Medicare Covers, is especially easy to use to find coverage and pricing data. Comparing supplemental plans in your area, what they cover and at what price, is also easy to search. Because you should never forget, patients like you have rights. Insurance companies have a duty to you, and they are mandates that providers must follow. I so thank you for watching this video. Do you know your likes, comments, and subscribes help this channel grow to reach out to many more patients like you? So thank you.